from University Malaya in 2018, making a pivotal point in academic journey, yeah, embarking on a medical career for 16 years ago as the house officer at Hospital Tuanku Jafar Seremban. She steadily ascended in the realms of this special subject and of course in her field, yeah, which is head and neck surgery. And the topic for today is what a year of ENT and dive medicine taught me. So please put your hands up and give a warm welcome to Dr. B. Chu Yin. Thank you.
Hello, good morning. Welcome to MIDE, everyone. Today, the vibe of the exhibition hall is simply good. Okay, so after the very interesting discussion panel on adaptive diving, it goes to show that diving really is for everybody with the correct support and awareness. So now let us change our focus now to what a year of ENT and dive medicine has taught me in the last 1 year. Let's test my slides. No, it's not moving. And not moving as well. Okay, for those that haven't met, let me give you a short introduction. I'm an ENT specialist, which means that I treat anything from ear infection, hearing loss to sinusitis. I'm also a certified dive doctor, which means that I'm an EDTC Level 1 medical examiner of divers, qualified to assess the fitness of diving for both recreational and also commercial divers. Beyond all of that, I'm an avid scuba diver myself. So I may be one of the few ENTs in Malaysia that holds both qualifications. So I find myself in a very unique situation where I can bridge the gap between dive medicine as well as ENT. Okay, so today is not a technical lecture. It's about real cases that I've seen in the clinic in the past 1 year, whereby I saw a lot of divers, free divers, not just beginners, instructors as well as DMs who have common but often overlooked issues. I'm also going to share some things to the dive masters and instructors in the group on what to look out for in your students so that they can dive safely, as well as share some tips, whether you're planning for a big dive trip or just want to be safer in diving. I'll share some tips to do that. And finally, I will also tell you how to get a free ear scope check at our Asunta booth later this. Okay, so last year was the first year I joined MIDE 2024. I presented a talk on safety in terms from the ENT perspective. I focused on a lot of ENT related conditions and also shared some basic tips on how to manage it. So what has changed in the past 1 year? So number one, I've seen a lot more divers in my clinic, both scuba and free divers. I also became a certified medical examination of divers, which gave me a broader sense of understanding in terms of diving in a professional setting. And also, most importantly, I started noticing patterns. Recurrent misconception and mistakes that keep recurring. And this leads to dive issues that can easily be sorted out if there is just better awareness of the condition. So because of this, I'm inspired to share my knowledge with the dive community and hope to help everyone have a clearer understanding and also be able to dive safer. Okay, so in the next 10 minutes, I'll be sharing some cases that I've seen in the clinic and also the lessons behind it. So let me introduce you to James. James is a male scuba diver in his early 40s. He has been certified for more than 10 years and logged in dives for more than 150. So he's a confident, experienced diver and he loves to dive travel. However, he always has equalization difficulties. He's always the slowest to descend among his dive group, and when he returns from a dive, he has muffled hearing or ear block. He always assumed that they were just how his ears were or that he was just aging and he left it. When he came to see me, I examined him and we found out that he actually had eustachian tube dysfunction. So I tailored a personalized treatment plan for him. He didn't need surgery, and then also did some equalization retraining. After that,